Hi, I'm Greg Moyer. I'm Vice President of Products with Infina Connect here in Cary, North Carolina. Our CEO, Sue Tong, was running a healthcare services company back at the end of 2010 when Infina Connect was being born. So we quickly nailed down the word Infinity as part of our company name, and then it was just a short hop to the name Infina Connect. So the name has been well received. We like it as employees. It's distinctive. It's unique. It has one issue though, and that is a lot of people mispronounce it. So let me go on record to say it's very easy to pronounce. Think of the word infinity and then simply shorten it to Infina. So we're Infina Connect. So once we had the company name, our logo, we understood, had to somehow incorporate the infinity sign, which is a figure 8 turned on its side. But in the end, we selected our current design, which we think which is a 4-lobed design using the infinity sign, and we think it's a very simple and elegant synthesis of the infinity sign and the medic cross. Our tagline is bending the healthcare cost curve, or more simply, bending the curve. It describes the achievements of our earliest adopters of our solutions, and probably more importantly, captures the most urgent aspect of our mission as a company. If we were starting this company today, knowing what we know about our company today and who we are, would we suggest anything different in terms of company name and logo and tagline?
There was a few actually thrown around before, like confer healthcare system, this conversation. So you think of referral, like confer. Somebody talk about a converge healthcare system.
I put Vitasphere. I thought it was, like IBM has WebSphere kind of, because we're trying to do like, Infina is trying to be kind of all-encompassing.
I like the idea of the connect, because if we think about the idea that we're a physician marketplace, right? That we're connecting, everything we're about is connecting. So that's what we're about. So I think connect has to be in there.
And I think that's, to me, that's the essence of how we're bending the curve, is that in healthcare today, you've got these silos or islands of highly sort of integrated, technology-rich places, but in terms of their connections with each other, they tend to be very, very poor. So any of these that you all prefer as alternates to Infina Connect? So if we had to do it again, we'd be some variation of Infinity. Cofinity, Confinity, something like that. It sounds like Infinicare.
And Barbara and I were talking about this earlier, and that's what for the logo she was starting to draw out there. If we could possibly use that in the logo, in reference to the new tagline of bending the healthcare cost curve down. So I'm wondering, I'm not a graphic designer, but I'm wondering if we can play with that somehow.
Cool. Sort of instead of the infinity sign, use something that's more along the lines of conveying bending the curve.
And the thought I had is that the blue line is the bending the healthcare cost curve, and then each of the green lines represents like the drug registry and A+ kids and ICC. So you've got the general idea, but then each of the curves represents one of our products.
Contributing to the overall bending of the cost curve. Cool.
That's a great idea.
Yeah.
I like it.
So what do you think about, you did like, something like,
Should have brought blue and green.
that.
Oh, we got the infinity sign going on there. We had a couple suggestions this past week. Lowering healthcare costs with intelligent software. So it's an attempt to kind of capture that essence of bending the healthcare costs, but still kind of capturing what we do and what we deliver. And then we care for cheaper healthcare. And it's good to reaffirming the tagline. I guess we like our tagline. We seem to really like our tagline. What I like about bending the healthcare cost curve is that it goes to our mission. Our mission is to bend the healthcare cost curve by providing cloud-based solutions that have a profound impact on healthcare costs as well as population health.